Good evening, everyone, and thank you for joining us. Before we get started, I wanted to just share a few brief housekeeping announcements. First, we would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 vaccine questions over the next hour with our panelists. And if you have additional questions or need clarification, please use the Q&A function in Zoom. And as a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Facebook, so please feel free to share the link so that others can tune in, and we will paste the Facebook Live link to this event in the chat momentarily. And finally, a recording of tonight's event will be available on the Montgomery County YouTube page, and we will also send that link out to everyone who registered tonight once the video is uploaded. So now I will turn it over to our moderator, Mukesh, to start tonight's town hall.
Well, good evening and namaste, everyone, and thank you so much for joining tonight's very important virtual town hall on the COVID-19 vaccine. My name is Mukesh Swaroop, and I'm the Government Relations Director for BAPS Public Affairs. Among the nearly 100 temples that BAPS has in the United States, we have one right here in Montgomery County in Souderton. I'll be serving as your moderator tonight, and we have a great panel here with us, so let's get started. First, I'd like to ask each of our panelists to briefly introduce themselves, and then we'll jump right into the questions. Let's start with Dr. Valerie Arkoosh.
Good evening, everyone. It's a pleasure to be here with you tonight. I'm Dr. Valerie Arkoosh. I am chair of the Montgomery County Board of Commissioners, and I'm also a physician and have been leading a lot of the work here together with this great team you're going to hear from tonight in our fight against the COVID-19 pandemic.
Thank you. Next, we have Dr. Richard Lorraine.
Good evening, everyone. Thank you for being here, and thank you for inviting us to share the information with you. I am the medical director of the Montgomery County Office of Public Health, and I've held that position for about 4 years now. In addition, I am a practicing internist in Montgomery County and have been practicing for about 35 years.
Thank you. And finally, we have Ms. Janet Panning.
Thank you, Mukesh. It's a pleasure to be here this evening. I'm the interim administrator for the Office of Public Health, and I work with a great team of division directors, and I've worked with them throughout this pandemic. Thank you.
Well, thank you all so much for being here this evening. We're going to jump right in. So let's talk about the vaccine itself. Val or Richard, if either one of you could take this first set of questions. There are some who are hesitant to get the vaccine because they're not sure if it's safe, if it's been tested for long enough, or they wonder whether you can even get COVID from the vaccine itself. Could you speak on how safe the vaccine is?
Val, do you want to take that or shall I?
You start, Rich.
Okay, so the vaccine is, like every other vaccine, something that is effective in helping to prevent disease, and it does have side effects. Of course it does. Everything has side effects. It has been tested in a very scientific manner, and one of the things that people are concerned about is the period of time that it has undergone testing, because obviously we haven't had in the past a vaccine that's been prepared and brought for public use in as short a period of time. So there's some concern that perhaps there might have been some shortcuts taken in the safety of the vaccine, and that's not at all true. There are specific things that were done to shorten the period of time of development. One of them was in terms of the enrollment period for the clinical trials. Oftentimes, when you have a clinical trial for a new vaccine or a new medication, it may take many years, 2, 3, even 4 years to fully enroll in the trial. In this particular case, they enrolled in a period of months rather than years. And another thing that really shortened the period of time, and this was a master stroke, is that normally none of the manufacturers will start manufacturing the vaccine prior to its actual approval for use, because if it's not approved, they will have lost a considerable amount of money. In this particular instance, the pharmaceutical companies were authorized to start manufacturing when they reached phase 3B in their clinical trials, which is fairly late, but still long before they actually got their approval. The proviso was that if, for whatever reason, the vaccine was not approved, those stockpiles would be destroyed, but the companies would be made whole. So that shortened the period of time considerably with absolutely no loss of safety. In terms of the side effects that do occur with this vaccine, it can vary from nothing at all to what we normally see with our flu vaccines and with our pneumonia vaccines, where you might have a day or perhaps two where you have some chills, a fever, not feeling well, muscle aches. Those things are fairly common. The most important thing to note with these side effects, with the types of vaccines that are being used, it is impossible to get COVID, to get the disease from the vaccine. It cannot happen. It's not even a question. We can talk a little bit in the near future about how the mechanisms of these vaccines actually work, but none of them present the live virus to the body. It is not possible to catch the disease.
Great, thank you for that. Here's a follow-on question. Some have heard about the mRNA technology behind both the Pfizer and the Moderna vaccines and wonder if it can harm you by changing your DNA. Can it?
That comes from the fact that we are using an mRNA technology. The quick answer to that question is no, it does not change your DNA in any way. mRNA vaccines have been in development for about 10 years, but this is the first actual practical application of it. The messenger RNA is basically an instruction sheet that the body uses to produce proteins. So the way the mechanism of these vaccines works is that this messenger RNA, which is an instruction sheet, is presented to the organelles, the small functioning units of the cells, and it tells those organelles to produce a protein. The protein is very, very similar to the spike protein that's on the outside of the coronavirus. So that's how the body will recognize that and present the lymphocytes that will help to destroy that virus. But this is not anything that actually enters into your own DNA. It is just an instruction sheet that tells the body cells to produce this protein. There's absolutely no effect on the DNA at all.
Okay. Now, we do have 2 vaccines that are approved so far for use in the US. Are there any differences between the 2, and are they different from any of the ones that are on the horizon, like the Johnson & Johnson vaccine?
Yeah. I'll
Both
hop
the-
in for a bit on that.
Okay,
Yeah.
go right ahead.
So it's the 2 vaccines that are currently approved. One is made by Pfizer and the other one by Moderna, are very, very similar vaccines. And as far as we can tell from clinical trials, there's really no difference between the 2 in any appreciable way. And I think what's really important for people to consider as they're deciding whether or not to be vaccinated is that both of these 2 vaccines are basically have been 100% effective at preventing serious illness that would require hospitalization and 100% effective at preventing death. So I think everybody always thinks about the risks and the benefits of any medical treatment. And in this case, I think the benefits are quite high, and that has to be balanced with the risks of not being vaccinated. So far here, just in Montgomery County, sadly, we've lost 1,200 lives to the coronavirus. Those are the ones that we've documented and know about. So I'm very encouraged by the fact that these vaccines are so good at preventing hospitalization and death. Now, we may have a 3rd vaccine available to us shortly. That one is made by Johnson & Johnson, and we should be hearing something official from the Food and Drug Administration in the next few days or a week. And that vaccine is a little bit different. It's more similar to a traditional like flu type vaccine or measles type vaccine that people might be more used to. But again, appears to be, and we haven't heard the final word yet from the FDA, but it also appears to be very safe and very effective.
Okay, great. So let's talk a little bit about the rollout of the vaccines. Valerie, there's been a lot of talk about how the supply of the vaccine has been constrained and the lack of appointments, no matter where you try. Why is it taking so long to get information about how and when and where everyone can get vaccinated? It seems like within Pennsylvania, we're doing a fairly poor job. So could you address that?
Yeah. Well, first of all, I think the biggest problem is a very simple one of supply and demand. There is an enormous demand for the vaccine, and there is not nearly enough supply. And what we're seeing is so many people, all of us, who have been in our homes, not seeing loved ones, not spending time with friends for nearly a year at this point. And people are so excited to get vaccinated and with the hope of being able to return to a little bit more normal life, but we just don't have enough vaccine yet. So despite what Rich talked about, which was phenomenal, that the federal government actually paid these companies to go ahead and start producing vaccines so that there would be some vaccine immediately available once they got approved, that still hasn't been enough to meet the demand. So the way the distribution works here in Pennsylvania is that 66 of the 67 counties, and Montgomery County being one of them, get our supply of vaccine from the Pennsylvania Department of Health. And as a consequence, we're under the directives of the Department of Health in terms of how we distribute that vaccine. And under Department of Health guidelines, anyone who's 65 years of age and older is eligible, and anybody who's under 65 with a list of one of a dozen medical conditions is also eligible. We estimate that in Montgomery County, that's about 250,000 people. And the county itself, our county health department's only getting about 4,000 to 5,000 doses a week. So you can see we've got quite an imbalance there. Additionally, there are some drugstores getting vaccine. There's a few doctors' offices that are getting vaccine, and our hospitals are getting vaccine. But it's been very frustrating for people, but there is no single centralized registry where, for instance, people could go online and pick an appointment at a particular place. I think that day might come when there's more vaccine available, but right now the supplies are so tight, and we've had disruptions due to weather and other issues that unfortunately right now people can pre-register with Montgomery County for our county vaccine, and then they do have to check other websites, drugstore websites, for other opportunities. And we do know it's been very frustrating.
Got it. Okay. So that brings up really a I think you've actually addressed a lot of the questions that are here. So Janet, I'll direct the next question to you. If you, if we all take a look at the news, one thing that's very common is confusion on where and how to register. Some states have a centralized system, and as Val pointed out, right now Pennsylvania does not. Could you explain the registration and the scheduling process a little bit?
Absolutely.
Yeah.
Yes, thank you, Mukesh. I would like to show just a brief PowerPoint presentation that I think will help to explain this. If I may share my screen for just a second. So, first of all, this is a teaser. These are some of the slides that you'll find in our press conferences and our website. We have lots of very good resources and information on there. This one is the 14-day positivity rate for the last year, combined with the number of tests. This is our positivity rate, and we want to get down to 5%. And this one shows a little history of what we all know has happened over the last year with the increase in positivity and much other valuable information. But what I really want to take you on is a tour of our website, because I think that the question that you asked can be answered on our website. If you go to www.montco.pa/COVID-19, you'll see this page here. And first, I would like to show you this section here that has the number for our call center, 833-875-3967. Which is open Monday through Saturday, 8 a.m. to 8 p.m. for COVID-related questions, as well as a COVID-19 email. Now on this website, if you scroll down, you'll see a regional map of vaccine providers in our area, and you can click on a list view to see the contact information for the vaccine providers and figure out how to, from their information, access vaccine through the multitude of vaccine providers. Of course, everybody's in the same position as us without having information or without having enough vaccine to meet the demand. Now, if on this website, you click on vaccine information and go to the county resources, you come to our county vaccine webpage. And on this page, we have updates on each of our clinics. We've had so many snow days in the last 2 weeks that we have had a lot of updates for when clinics are opened or closed because of snow or if there's a delay. We also have on here information about vaccines that we've given, vaccines we've received, and the total in our county that have been administered. But also we have information about individuals who have pre-registered for phase 1A on our website. This is a little bit old. It's now over 170,000 people that have pre-registered as phase 1A eligible. I'd like you to know that we're going to move through that list fairly quickly as we receive vaccine, because many people, especially those that registered early on, have gotten vaccine at other locations. So don't despair. If you scroll down on that page, you'll see two pre-screening surveys. The first one is for people that are in phase 1A because of their occupation. And the business or the individual can fill out the survey that looks like this. And then the second one is a survey for people that are individuals that are eligible for phase 1A because of their age, 65 or older, or because of pre-existing conditions. So the first step for the county process is to click on one of these surveys and get your name on that pre-registration list so that we can take people by the order that they come when we receive vaccine to get appointments. There's also a number of state resources. I just put this slide here because you should check out the Pennsylvania Department of Health resources and then our general information here. So while I'm leaving this page up for a minute, I would like to tell you about what happens after you pre-register. So currently, if you're technologically literate and able to pre-register, eventually you will get a link to an appointment. We use a state system called PrepMod. And because those links are so easy to share, we've instituted a token system so that when you get your invitation to register on PrepMod, you will also get a number that you have to put into a form to access PrepMod. And that's a one-time use token that once you use it, nobody else will be able to get it, because it's so easy to share the links that we've had many ineligible people show up at our clinics that we've had to turn away. And we really are eager to get through our list of people that have been so diligently waiting since the beginning of January. So you get your token, you put it in the form, you sign up for an appointment at one of our clinics. Starting Friday, we will be administering Pfizer vaccine. Until that time, we've been administering Moderna. We will have both vaccines on a 28-day cycle so that no matter which one is available, we will be able to serve people with that vaccine. And what we instituted this week was a support system by phone for people that have barriers to technology. So if you are unable to pre-register because you have barriers to technology, you can call our call center number, that 833 number, and they will put you through to the people, our number of volunteers that are helping people to get pre-registered on the system. We also then, so that when those people, when it's time for those people to receive an appointment, we've already generated an email for them that will go back to the agencies into the system, and those people will contact them by phone and will register them for the vaccine. So it's all done through phone. If you're somebody that has no access to technology, you can just use the phone to both pre-register and to register for the vaccine. This is done through our Office of Senior Services, which also will do some light case management. They will try to connect you with transportation services, for instance, if you don't have a way to get to the vaccine. Thank you.
Great, thank you. That's great information. Richard, I'll direct the next question to you. Where can we all get the vaccine? Is it only administered through the county, or can you get it other places like local pharmacies? So where can you get it?
Absolutely. So that has been touched on by both Dr. Arkoosh and Ms. Panning. To be clear, there are multiple locations in the county where vaccine is being administered. One of the ways that you can find out is through our county website, as Janet showed. There is a map there which will show every place in the county that is authorized to give vaccine. Now, this can be a healthcare system. This can be a private medical office. This can be a number of pharmacies. The pharmacies are working with the general public. Medical practices are typically limiting that to their own patients, but there are multiple sources where vaccination can be available in the county. Now, it's also important to note, and I believe this was one of the questions in the Q&A, that the county registration site has nothing to do with any of these other sites. So if you register on the county registration site, you are only registering for our vaccine clinics. All of these other vaccine providers have their own method of registration. And as Dr. Arkoosh said, there is no central Pennsylvania registry. So all of them are doing that separately. So there are a lot of people who are spending a lot of time going to multiple websites, multiple phone numbers, and trying to sign up at these various providers. I certainly can understand that. The only thing that we ask is if you've signed up on the county website, that you let us know if you have gotten your vaccine elsewhere when we contact you, so that we are able to give that slot to another person. Something that's also related that I also did see pop up on the Q&A is the timing for the response to these surveys. So these surveys, we started the business survey actually before the beginning of the year, and the individual survey in early January. The first full day that the individual survey was open, over 30,000 people registered. We are receiving on average less than 5,000 doses per week from the state for us to give out. There's some encouraging signs that that's going to increase very soon, but we can't really count on that. But if you simply do the math, for people who signed up early on, 30,000 the first day, if we're getting 5,000 a week, it takes us 6 weeks to get through the first day. So that is why there is this delay in getting back to people. We haven't forgotten you. We haven't lost your registration. We have it. And as soon as we have a vaccination appointment available for you, we will be contacting you. It's the same also for the business registration. So for the healthcare personnel who are in the 1A category, we've made our way through a significant number of them. There are still some remaining on our list, but the reason why you might not be contacted is we are getting to you. So as soon as we get to you on that list is when you will be sent that link that Janet had mentioned, where you will get an individual token to schedule an appointment. We ask everyone's patience with this, and we also ask your cooperation. We had to go to the token system because of the sharing of links. When we would send out a link to make an appointment, we had a lot of people doing the phone a friend, and a lot of people, as was mentioned, were able to schedule appointments, but when they came to the clinic, we found that they were not eligible under 1A, and we unfortunately had to turn them away. That means that we were unable to use that appointment for someone who was legitimately on the list that day. And our goal is to continue immunizing as quickly, as expeditiously, and as fairly and equitably as possible.
Okay, great, thank you. Val, here are a couple of questions for you related to the rollout phases, and we can all take them together. So we've touched briefly on on some of the rollout phases like 1A and whatnot. Could you explain the differences in the phases, what the different rollout phases are, and when will folks get their turn to get the vaccine? And then in addition to that, one thing that we've heard a lot about in the news is people finding ways to cut the line and get the vaccine before their specific group is supposed to get it. Could you explain the importance of following the rollout by phase and not finding ways to jump the line? I think you're on mute.
Sorry about that. So right now we are in Montgomery County following the directives of the Pennsylvania Department of Health. And I want to mention that because Philadelphia, our neighbor to the east, is under a different set of rules because Philadelphia gets their vaccine directly from the federal government. They are not required to follow the Pennsylvania Department of Health's rules. So one of the things that's been very confusing for people here in the suburban counties is they hear one thing out of Philadelphia and something different in Bucks, Montgomery, Delaware, and Chester County, because we are all following the Pennsylvania Department of Health rules. So with the exception of Philadelphia, the rest of the state is in 1A right now. And 1A is anyone who's 65 years of age or older. And you can be under 65, but you need to have one of a list of about 12 medical conditions. And these conditions have been found by the Center for Disease Control to be highly associated with getting a very severe case of COVID, one that's likely to end you up in the hospital or with serious complications. So that's the phase that we're in right now in the county. And as I said, we think that's about 250,000 people. Also in 1A are healthcare workers, paramedics and EMTs, frontline public health nurses, people like that. So it's a pretty big group in Montgomery County. As we get through that group, then we'll move into 1B. And 1B includes a lot of people who are there simply because of their profession. So they could be younger and perfectly healthy, but if they're a teacher, a member of the clergy, a postal worker, a public transportation driver, like a SEPTA bus driver, a grocery store clerk, people like that, the people that have really been keeping our world running for the last year, they are in the 1B category. Now, I just want to do a little bit of comparison to Philadelphia because I know probably many of our listeners, some might live in Philly or be, right here on the border, have friends in Philly. In Philadelphia, for their 1A group, they included the healthcare workers and the paramedics, but they were only vaccinating people 75 years of age and older. And now they have actually now moved to 1B because they've gotten mostly through that 1A group, and they've begun to vaccinate teachers and some other workers in Philadelphia. So this has caused a lot of confusion. That is just in Philly, that is not in Montgomery County. So there's a difference between the two counties. So when it comes to kind of this idea of jumping the line, it's been, frankly, really heartbreaking for a lot of people. As I mentioned, we've got 250,000 people waiting. We're getting about 5,000 doses a week. Our pharmacies and hospitals in the county collectively aren't getting much more than that. Altogether, there's about 12 to 15,000 doses coming into the county in total on any given week. And so we've got all these people waiting. And if somebody younger and healthier gets a link from a friend and they make an appointment through it, usually two things happen. One is the person who made the appointment didn't even realize they shouldn't have that link. And two, when they show up for their vaccine, they're going to be sent away. So it's not that, I think a lot of people didn't even understand that they were jumping the line. Some, kind, wonderful friend sent them a link and they're like, oh, great. And they tried to make an appointment and they got one. But what that did was it kept that line of 170 some thousand people that we have waiting, who are all in that 1A group, just waiting another day. So we have gone to great lengths to implement a system that's hard to get around. It's not perfect, but it's pretty good. And we really want to make sure that only people in the 1A group are getting vaccinated right now.
Okay. I think sort of a similar question to that, a question I saw here in the chat or the Q&A is that as a Pennsylvania resident, can I go to another county to get the vaccine?
So again, a little bit complicated answer. Right now, Philadelphia is only vaccinating people who live or work in Philadelphia. But the rest of us are, again, under the Pennsylvania Department of Health directives. And we've been told that we cannot turn away anybody based on where they live. So we can turn them away if they're not in that 1A group, but we cannot turn them away based on where they live.
Okay.
But
Right,
one
thank you.
important point about that, I don't want to forget to mention, if you do go some distance to get your first dose, you must be prepared to go back there for your second dose, because the receipt of second doses depends on the number of first doses given. So we at the county get a certain number of second doses based on the first doses that we gave. If you drive to another community in another part of the state for your first dose, that is where your second dose is going to be. We would not have a second dose for you here in Montgomery County.
And if I can actually add in on that too, we are starting to see, because of some logistical problems in the state with these second doses, there is a little bit of a delay in the vaccine providers receiving those second doses. So some folks, even within the county, who have gotten their vaccination, their first vaccination at a pharmacy or similar places, are now being told by that pharmacy that they don't have that second dose for them. Those people, a lot of those people have been contacting us at the county, and we've unfortunately had to tell them that because of this allocation of the vaccine for the second doses based on the first dose, we're not able to give them a second dose. But what we do want to reassure them about is that they can and should go back to their original vaccination provider, whatever pharmacy or organization that was, and speak to them again, because the explanation may not have been complete. They may not have the second dose for them right at that time, but they will be getting that second dose from the state. It may be a week delayed, it may be 2 weeks delayed, but they will be getting it, so that they can return to that pharmacy or location and they will get their second dose. And one final thing that goes along with that is that we've been getting some data from CDC and other organizations in terms of those second doses. We originally were given a very specific schedule for the second dose, 3 weeks for the Pfizer, 4 weeks for the Moderna vaccine. And it turns out that you can go longer than that period of time and get the same efficacy. So for both of those vaccines, currently the guidelines state that you can get them up to 6 weeks after the initial dose and have full efficacy. So if your second dose is delayed a week or 2 weeks, you will still get the same result.
Okay, that's a very good thing to know. Richard or Val, this question is for you. Many of us have been stuck in our home for a year now. I know for a while, the highlight of my day was going out to the mailbox to get my mail, because that was the only time in the day I actually got to go out. But when can we expect to go back to normal, and will it really be like it was before?
That really is the big question. We do a lot of projections. We look at a lot of numbers. We have this concept that you probably have all heard at this point of herd immunity, which is the point where there's enough immunity in the population that there's very difficult transmission of disease. The estimate for that is somewhere between 70 and 80% of the population needs to either be immunized or have had the disease before there's enough resistance that the disease won't spread very easily. So that sort of relates to your question as when is the point where we'll be able to get back to normal or some semblance of normal, because I think that we're going to experience some permanent changes as a result of this. My one observation right from the beginning is I think our custom of handshaking is never going to certainly come back the way it was before, and may be very, very limited in the future. That's just one example. From all the things that we've seen at this point, all the projections that we're making, we are hoping, and this is almost a conjecture, that sometime this late spring or summer, there will be at least a little bit of improvement in the activity level where we can start getting together a little bit. But probably by the end of the summer is where we might expect to see enough that we can start really resuming our normal activities again with ongoing precautions, such as, of course, good hand hygiene.
Right. So speaking of those precautions, Janet, after we get the vaccine, are we good to go? Can we throw away those masks, or what precautions do we need to take after getting vaccinated?
That's an excellent question, Mukesh. We still have to take precautions because even after we get our vaccine, it's possible that we could still transmit the disease. So we still need to wear our masks, and we still need to maintain social distance and wash our hands. So unfortunately, we can't toss those masks out anytime soon.
And I just want to add to that, as a reminder, that we still are not able to vaccinate children. So the youngest age that can be vaccinated right now is down to age 16, and that's with the Pfizer vaccine. The Moderna vaccine is approved only down to age 18. And so while hopefully by this summer, we'll have most of the adult population vaccinated, at least those that want to be vaccinated, we will not probably have vaccinated any children yet. The studies are just, they're underway, looking at children down to age 12. And I think that they probably have another month or so of enrollment to go through, and then all the data has to be analyzed and submitted to the Food and Drug Administration. So there will be a significant cohort in our population, which is all of our kids, that probably won't be able to be vaccinated until sometime this fall. And so that will be a factor in terms of all the rest of us taking off masks and things like that, because we want to make sure that all of our kids are safe too.
Okay, I have a few questions here in the Q&A chat. So let's say there is an appointment where someone doesn't show up. Is it possible to call someone who might be waiting to see if they can come in and get the vaccine in the last minute? Is a system like that even possible?
For the most part,
Go ahead.
you want to take it, Janet?
I was going to share that we do maintain a list for the end of the day because we want to make sure that every dose is used. And in the Moderna, there were 10 doses to a vial, which meant that we could theoretically have 9 doses left over. So we maintain a list of persons that are eligible for phase 1A that are willing to be called at the last minute to come in and get a dose. But we watch the vaccine very carefully throughout the day and make sure that we don't open any vials if we don't have to.
So that if someone doesn't come in for an appointment, that dose doesn't go anywhere. It's just given essentially to the next person. So we use through the day the amount of vaccine that we need for whoever has come in. And then, as Janet referenced, at the end of the day, we're down to we're opening single vials at that point because we don't want to waste any. And the most that we might have, if we have to open one vial and there's only one person, there might be 9 essentially open slots. And that's where we do maintain that list, which is 1A qualified individuals who have signed up on our website, who we then call, they're essentially the next in line. So we do call them and we get them to come in so that we don't waste any of those doses.
Thank you. And I would also like to emphasize that people should not just show up at a clinic hoping that they will get vaccine, because they will be turned away, which we hate to do, but we will do.
Okay, good to know. We talked a little bit about the number of vaccine that we're getting per week. What is the outlook in terms of that increasing?
I think it's optimistic. I am in a regular, sometimes most days of the week, conversation with the Pennsylvania Department of Health and the Secretary of Health. And Pennsylvania is slowly starting to get more vaccine. The Biden administration has really made an effort to help these companies increase their production, and we're starting to see the results of that. So I'm hopeful that within a week or two, we'll start to see a little more vaccine coming in. Maybe instead of about 5,000 doses a week, we'll be more like 6,000 or 6,500 doses a week. So we're not going to see dramatic jumps here in the next few weeks, but I do anticipate that we're going to slowly, steadily see more vaccine coming in.
Okay. The last question with regard to last-minute vaccinations that seemed to jog a little bit of interest here on the Q&A. A few questions about how do we submit our name so we can be on the list. I think we've talked about that earlier, right? You just essentially have to pre-register. Is that right?
Yeah, that would be correct. We work through that list, and every day it is being updated. So there isn't any informality about it. It's just whoever is next, that's where we're going.
Okay. I think the last couple of questions really just are, there's some concerns about Pennsylvania's performance with regard to other states. Obviously you can check in the news. There's articles about states that are doing well, states that are not doing as well. So anything that you can speak about to how Pennsylvania in general is doing.
I'll offer a couple comments and then see if others have comments. So I can speak to Montgomery County specifically that the doses that the Office of Public Health gets, the County Office of Public Health, we are getting into arms very, very quickly. We have 2 different locations in the county that are each giving 1,000 doses a day. That's both first and second doses. And so we have run out of vaccine. We are so efficient at giving it that we had a situation a week ago where we were just flat out of vaccine. We didn't get our delivery in time and we ran out. So here in Montgomery County, I think we're doing a pretty good job of utilizing everything that we get. But we have a health department here. And there are only a handful of counties in Pennsylvania that have health departments. And the absence of that local infrastructure, I think, is really making it a complicated situation for so many of our residents and my colleagues in other counties, because they don't have that group of health department experts like I am so able to rely on with my folks here on this call to help get this set up and administer this vaccine. So they are much more reliant in other counties on drugstores, on local hospitals, and not to say that those entities aren't, giving vaccine, they are, but their ability to do what we're doing here in Montgomery County, which is to set up multiple locations doing large volumes of people in a day, is very, very limited. We're hoping to have enough vaccine to set up a 3rd location within hopefully about 10 days that can also do another 1,000 doses a day. So we can just keep expanding out because we've got that public health infrastructure, but the vast majority of the state does not. So it has been a very challenging situation.
And just as a matter of interest, I can kind of add into that. The plan going forward, and this doesn't relate to Montgomery County, but it relates to those other counties that don't have that same type of infrastructure. The plan going forward for them is to utilize the state's military assets, the Pennsylvania National Guard. There's organization now working on setting up their equivalent of strike teams, which will consist of a group of vaccinators and their support staff that will be sent out to each of these counties to provide that same type of infrastructure that we are so fortunate to already have here in Montgomery County.
And I'm just going to grab one of the questions from the chat that's kind of relevant to this. Jill asked if the county gets 5,000 per week and pharmacies and hospitals get 12 to 15 per week. That 12 to 15 per week is the entire amount coming into any entity in Montgomery County. So the county health department is getting about half, some weeks more than half, of the total doses that come into Montgomery County. So first and foremost, we would urge all of you to sign up on our list. However, it is completely okay to sign up on other entities' lists. So if you got the time to click through to some of the drugstores and other entities that are listed as vaccine providers and sign up on their lists, you should do that. There's no problem with that. And whoever gets to you first, whether it's the county health department or a particular pharmacy, that's where you'll go to get your vaccine. And if that other entity contacts you and says, oh, we have an appointment for you, just say, never mind, I already got my vaccine. And everybody has a very long list of people. So they'll just move on to the next person. So folks should feel empowered to put their names on more than one list. There's really no problem with doing that.
Okay, great. I think the last question we have in our Q&A is that there's a little bit of concern from folks who, they hear about their friends or others getting the vaccine, and sometimes it feels to them like it's, based on who you know. Could you address and allay some of those concerns?
Well, so I think two things have been happening in that regard. The first is that sharing of links that we mentioned earlier, that was really a problem. And all kinds of people that should not have been getting appointments were getting appointments. And at least if they got them with the county, we were doing our best to determine that they shouldn't have an appointment and asking them to come back when it was their turn. But other entities, and we hear that this a lot from not all, I want to be very clear, not all, but some drugstores who have not really been screening people very thoroughly and have vaccinated people that were not in the 1A category. I think that the other thing that's going on is that the different health systems are reaching out and vaccinating patients that are in the 1A category that are in their health systems. But, sometimes when someone's seeing that from the outside looking in, they don't really understand how that person got vaccinated. So there's been a lot of different ways that people are getting vaccinated, and it isn't always entirely transparent. And in some cases, people were jumping the line. And so we've added this layer of technology on that Janet described by sending out what are called tokens, single-use tokens, to try to prevent people from sharing the links. But the system isn't perfect, and I'll be the first to admit that. But at least here at the county, we're doing our best to make sure that the people who have been patiently waiting in line and who are qualified in this 1A group are the ones that are getting the vaccine that we have to give.
Okay. Here's actually a very practical question. So if my wife and I share the same email address, how can you differentiate between the two of us?
Yeah, Janet, you want to grab that one? It's a common question.
So I have two answers for you. One is that we have started sending out weekly updates to people that have been patiently waiting in line, and it's through a medium called Constant Contact. And Constant Contact only sends one email out per, if you share an email, you only get one newsletter update. However, the system that actually holds everybody that pre-registered, which we call VOCHI will send out multiple appointment links so that you can get scheduled even if you're sharing your email with somebody. So a husband and wife that share an email will get 2 emails with the token, but they'll only get one weekly update from the Constant Contact. I hope that's clear.
Yeah, I think so. You'd mentioned before, I can't remember who, but one of you had mentioned before that if you get a vaccine somewhere else and you're registered elsewhere, what's the best way to I guess unregister if from all the other places where you might have signed up? Do you just call them up? Can you use a website? What's the best way to do that?
We have an email address, covid19@montcopa.org, that they can send an email to that email address.
For the other locations, we have no knowledge or control over their system. So that would have to be done on an individual basis.
Sure, great. All right, I think we've reached the end of our questions. So I want to thank every one of you, first for your time tonight, for keeping us informed, and for all the important work that you're doing for the community of Montgomery County. I also want to thank everyone who joined today and for all of your really great questions. I'd like to turn it back over to Kelly in case, Kelly, you have any housekeeping announcements.
Great, thank you. No, I do not, other than anybody who is registered today will get a link to the recording. And I also wanted to just remind folks, we did drop a link in the chat there to our frequently asked questions, but we will include all the resources that were discussed tonight in the follow-up email. And also, you know, if anybody has general questions, they can call our hotline or, you know, the COVID-19@montcopa.org address.
All right, thank you, everyone, and good night.
Thank you.
Thank you.
Good
Appreciate the
night.
opportunity. Good night.
Stay safe.